How should you really take Tamsulosin, also known as Flomax, and what about the side effects that so many patients never expect? One of these effects is so subtle, most people never connect it to their medication. I'm Dr. Jenny Carter, and today we're breaking down everything you need to know about this widely prescribed drug for enlarged prostate symptoms. Tamsulosin, or Flomax, is commonly prescribed to manage a condition called BPH, or benign prostatic hyperplasia. As men age, the prostate at the base of the bladder can enlarge, and muscle fibers in the prostate may tighten, making it difficult to pass urine. This can cause symptoms like slow flow, urgency, difficulty emptying the bladder, and frequent nighttime urination. Tamsulosin works by relaxing these muscle fibers, improving urine flow, and easing these frustrating symptoms. It's important to know that Tamsulosin isn't suitable for everyone. If you've had a previous allergic reaction to this medication, experience postural syncope, dizziness when standing, or feel lightheaded after urinating, speak with your doctor before taking it. Those with severe liver problems or planning cataract surgery may also need to avoid Tamsulosin, as it can increase surgical complications. Certain medications can interact with Tamsulosin and increase side effects. Since Tamsulosin can lower blood pressure, use caution if you're taking other blood pressure medications, including other alpha blockers like doxazosin. Erectile dysfunction medications such as sildenafil or tadalafil can also interact, and even some over-the-counter cold or allergy medications may affect blood pressure when combined with Tamsulosin. Always consult your doctor or pharmacist about your current medications before starting this treatment. The standard dose is 400 micrograms once daily. You should take it at the same time each day, preferably after your first meal in the morning. This timing helps ensure the medication works when you need it most and reduces the risk of dizziness or lightheadedness. Tamsulosin begins working soon after taking it, but maximum effect may take several weeks. Most patients will need to continue it long-term to maintain symptom control. It's generally safe to drink alcohol in moderation while taking Tamsulosin, but some people may feel dizziness or lightheadedness. If you experience this, it's best to avoid alcohol. If you miss a dose, take it as soon as you remember. If it's nearly time for your next dose, skip the missed one. Do not double up. Overdosing can slow your heart rate and lower blood pressure, causing lightheadedness or fainting, so seek urgent medical attention if this happens. Now, let's talk about side effects. Most people tolerate Tamsulosin well, but some do experience them. Dizziness or lightheadedness is common due to its blood pressure lowering effects. Ejaculatory dysfunction is another possibility, where semen output may be reduced or absent. Less common effects include headaches, nasal congestion, palpitations, stomach upset, such as nausea, constipation or diarrhea, and occasional muscle weakness. Rare but serious side effects, which require immediate medical attention, include allergic reactions, severe skin rashes, and episodes of collapse. Before we continue, a quick note. If you'd like even more clear, science-backed insights into how medications affect your health, consider subscribing. I share practical, trustworthy advice just like this, and there's a lot more to come. Tamsulosin's effectiveness can also vary depending on lifestyle. Take John, a 65-year-old office worker. He followed his routine closely, took his dose at the same time each morning, stayed well hydrated, and monitored his blood pressure. Within 2 weeks, he noticed significant improvement in his urine flow, fewer nighttime trips to the bathroom, and less urgency. On the other hand, Mark, a 70-year-old retiree, often delayed doses, skipped his morning routine, and didn't adjust his fluid intake. His symptoms persisted longer, and he experienced occasional dizziness. These real-life examples show how consistency and lifestyle can impact how well Tamsulosin works. You can also take small steps to improve your results. Avoid standing up too quickly after sitting or lying down, as sudden drops in blood pressure can increase dizziness. Maintaining adequate hydration is crucial, but avoid excessive fluids before bedtime to reduce nighttime trips to the bathroom. Regular light exercise, like walking, can improve circulation and bladder health, complementing your medication. The medication usually starts working within a few hours of ingestion, but optimal relief may take several weeks. Patience is key. Many patients worry that their symptoms aren't improving quickly, but gradual improvement is normal and expected. Tracking symptoms in a journal, recording how often you urinate, how well you empty your bladder, and any side effects, can help your doctor adjust your treatment if necessary. Common side effects to be aware of include dizziness, especially when standing, and ejaculatory changes. While these are often mild, they can affect quality of life, so discuss them with your healthcare provider. Less common effects include headaches, palpitations, nasal congestion, digestive upset, or mild muscle weakness. Rare but serious effects, such as allergic reactions or collapse, should prompt urgent medical attention. In summary, Tamsulosin is highly effective for managing urinary symptoms of an enlarged prostate, but its success depends on proper use, consistency, and lifestyle considerations. Take it at the same time each day, monitor for side effects, and maintain open communication with your doctor. These side effects aren't guaranteed, but knowing them puts you in control of your treatment. If you're prescribed amlodipine, you need the full picture beyond just lowering blood pressure. I've broken down its mechanism, crucial contraindications, proper dosing, what to avoid, like grapefruit, and a range of common to alarming side effects, ensuring you're fully informed. Click here to watch how to take amlodipine, Norvasc. High blood pressure medication, side effects, and empower yourself with vital health information.